The United States has become the first country in the world to record more than 2,000 deaths associated with coronavirus in a single day. There have now been over 20,000 deaths there and more than 500,000 confirmed infections. Our North America correspondent Nick Bryant reports now from New York.
Easter weekend in New York City, a date in the calendar that Donald Trump spoke of only a few weeks ago as the moment to reopen the American economy. But the restrictions will remain in place at least until the end of the month. And there were signs today the coronavirus spring could become the coronavirus summer. New York announced its schools will remain shut at least until September. Good Friday ended up being the most deadly day since the virus reached these shores. More than 2,000 people lost their lives. And America has now surpassed Italy as the country with the most coronavirus deaths.
783 people, 777, 799. These are just incredible numbers, depicting incredible loss and pain.
For America, this has been by far the worst week of the coronavirus crisis, but there are signs of hope. The hospitalization rate in New York is down. They believe they're flattening the curve. And evoking a famous quote from Winston Churchill, the governor here spoke of reaching the end of the beginning. This isn't an Easter ritual, but now a nightly one in New York. Part of the same wave of applause that has gone around the world. The sound of thanks, the sound of admiration for medical workers, the sound that momentarily drowns out the sirens. Nick Bryant, BBC News, New York.
Well, in the US, the danger from COVID-19 seems to be highest for America's minority communities who've been disproportionately affected. And the government here has admitted that there's emerging evidence of the same trend in the UK. The majority of frontline doctors who've died in the NHS have been of Black, Asian or minority ethnic heritage. And new research has also found that patients from these backgrounds are being disproportionately admitted to critical care units across the UK. Our Community Affairs correspondent Rhianna Croxford reports.
When you can't even hug your mother 2 hours after your father passes away, that pain really does affect you. It hurts you so much.
This is Amir Awan. His father, Nazir, died on Wednesday. This is his message.
If you loved your loved ones, if you love your parents and you love your friends and you love your family, please stay at home.
The grandfather of 6 was described by his family as a legend, the backbone of his community, a man who loved his city and gave so much back to it.
We said, look, you're going to get through this and you're going to fight this. And he lost his battle. He lost his battle within 2 days.
He's one of thousands of people who have lost their lives to coronavirus. Early research is suggesting that people of Black, Asian and minority ethnic heritage are being disproportionately affected. Only 14% of people in England and Wales are from these backgrounds, yet they currently make up 34% of patients in critical care units.
I do have colleagues who have taken to buying their own goggles and visors.
This junior doctor works at Ealing Hospital in London, one of the worst hit areas in the country. She says there could be many factors behind the figures.
Whether there's a genetic component, we don't know, but we have seen that certain underlying comorbidities like diabetes, high blood pressure, etc. can impact the way that you experience this disease. Places of worship can be huge sources of spread just because there are so many people in such a small space. There is clear evidence to show that coming from a lower socioeconomic background, if you can't speak English, and particularly in this current environment where you can't really bring a family member in with you because of our concerns with corona, that can have a huge impact on simply just being able to say, I'm in pain, I'm short of breath.
Labour has called on the government to urgently investigate the data and said it was deeply disturbed by the number of ethnic minority doctors who had died. Dr. John Chenekwinda is working on the front line at Kingston Hospital. He has recently lost his father and colleagues to the virus and says more data is needed.
I think it's really important we look at why people have died, look at the patterns, so that any lessons we can learn for the future, I think will be very important. And I'm hoping the Department of Health and Public Health England are collecting that data so we can help support communities in the future.
The Department for Health said its current data on coronavirus did not track ethnicity. But these families hope this won't lead to them being overlooked. Rhianna Croxford, BBC News.